sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, and fascinating health topics. And of course, where we do encourage you to call in to join in today. Well, and you may just want to call in and join in today. You've been waiting in fever pitch to get that opportunity. We're going to complete our series of 3 about LDA. Stands for low dose antigen. It is a very unique way of treating allergic conditions in the body, and not just for the common reasons you might think them necessary. In fact, today's topic is going to be talking about those things that you would never expect allergies to be responsible for, and to think that there's a way of doing it very safe and very efficiently. I think, well, it's been interesting to bring this to you through, of course, our guest today, the godfather of medical alternatives in Western Pennsylvania. His name is Dr. Roy Kerry. You know him well. Dr. Kerry, an ENT doctor, ear, nose, and throat, starts in 1969 all the way to the present, continues to treat in a very unique way, and LDA, low-dose antigen, is one of those ways. So we're going to be completing our discussion today about LDA, talking about those more exotic, unbelievably not making much sense ways that allergies can affect your lives. Hopefully you'll be able to listen and be enriched by it. In the course of our discussion with Dr. Kerry today, if you want to call in to ask a question or to make a comment, the number, of course, will be 412-825-6262. That's 412-825-6262. And oh, yes, I'll give that number additionally throughout the hour. Okay, fast-paced week this week, ladies and gentlemen. Today with Roy, we're going to finish off our trilogy. On Wednesday, we resume, well, I don't know if it's a trilogy. It just keeps never ending with Dr. Vavavoom herself, Dr. Susan Smith-Jones, talking about in the holiday spirit, how those spirits can affect you in a negative way. Talking about mineral spirits. I'm talking about spirits that sometimes you imbibe in too much. The treatment and prevention of hangovers will be the discussion, as she has requested it, for Wednesday the 7th. On Friday, we're finally going to open them up to you, getting your impression about all this LDA stuff and anything else that's on your mind. The first open phone show we've had in quite a while. We're going to be able to do that with you on Friday. And then the month opens up. I got a couple of guests I'm trying to get in before the break of the Christmas week. And, well, I'll let you know more about that as the week goes on. I'll be contacting him this afternoon. That's the way it stands right now. Now, in the office, this is big week for MCG testing. We have a device in our possession this week. We share it with another doctor in the Pittsburgh area. And so the way it's going to work this week with MCG testing, of course you know that, is a way to get information, very accurate information, about the status of your coronary arteries without having to undergo what up till now has been the only way to get that information. And of course that's through what's known as a cardiac catheterization. Who in the heck would want one of those, and especially with all the risks and consequences that could potentially come from it. Not necessary, however, with MCG testing. What MCG stands for is multifunctional cardiogram. And from your perspective as a person undergoing it, emphasize the cardiogram. You lie back, you kick off your heels, and over a 6-minute time period, you are literally swept every 82 seconds with another test. You complete actually 5 of them, very innocuously, while you are lying there, and then test is over, we send that information off to get compared to a database of 42,000 people. These 42,000 individuals have had the MCG test, but these 42,000 actually have had another test. They've had the gold standard, they've had a cardiac catheterization, and we can extrapolate from that electronic style exactly what the status of your coronaries are. How much plaque do you have in those coronary arteries? Turns out that'd be a pretty important thing to know. And so if you can know it without any harm to you, but just lying back for a 6-minute period of time, you can see where this could be quite beneficial. From my perspective, beneficial because once knowing where you stand, we should be able to correct, improve, and reverse whatever coronary artery disease that we find, whatever amount of plaque is there. It is reversible. You just have to know about it and strike out a plan in order to do just that. So MCG testing this week is a big week. We got tomorrow, we're out at the Monroeville office at Mid Health Services, right on, just off of Mosside Boulevard. St. James Place is actually the name of the road, right at the bottom of the hill, actually almost directly across the street from Dr. Oliver Caminos' old building, which lies now vacant. His new building, right there at that light as you're coming down the hill, turn right about 20 yards in, turn right again, and you are there. We're going to be there tomorrow all day, testing. Any of you who have a mind to want to be involved with this, give us a call today. We still have some slots available at this number, 724-942-3002. We'll get you slotted for that test tomorrow. We'll be able to go over the results of this test in a follow-up visit. And by the way, if you've had MCG testing out there and you want to go over the results and you know who you are, give us a call today to schedule a time slot for that so that we can go over those results that we did last week or 2 weeks ago when we were there. MCG testing in Monroeville tomorrow, and then in McMurray office on Thursday. So geographically, you know where you are and how easy one or the other of these locations makes it for you. If it's a Monroeville area or the McMurray area, MCG testing is this week. Happy to be able to bring it to you and sort of kick off the relationship of making those corrections well into the future. Now, also wanted to mention, as I brought to your attention just last week, Dr. Condrat, now in Rome. Yes, he moved to Rome. And I think he's going to be there for quite a while. He's on the faculty at the University of Rome in the research department, working with microcurrent in animals. He's a big proponent of microcurrent, as he's used it in our office when it comes to the treatment of macular degeneration, in particular glaucoma, and cataract formation. But he's at the University of Rome with his lovely wife Lee. Literally sold his, or is selling, one or the other, his Phoenix practice. But he will be coming back periodically to the USA to do those treatment seminars. And one is now scheduled here in my office in March. If you have eye disorders, if you know somebody that does, and if they're not too pleased with their progress, in fact, usually no progress at all, they may just want to try another way of handling this problem. I would strongly urge you to be a participant in the treatment seminar going to be held here in March. The dates run like the 22nd will be the day that we do the free seminar in my office, usually at 5 or 6 o'clock in the evening. Don't know the exact time, but you can circle the date. Then on the 23rd, 24th, 25th, that is Friday, Saturday, and Sunday, we'll be doing the actual treatment seminar with however large a group happens to be participating at that time, and he normally cuts it off at 10. So the 11th person, unfortunately, will have to wait for the next time here. So give them a call out there at his office at this number. Are you write it down? 623-516-0010. That's 623-516-0010. Someone will answer. Her name will probably be Nancy. Anyway, tell Nancy you're interested in enrolling in the seminars. She'll take care of you, and we'll see you then. I'll make this announcement a couple more times this month, and then we'll bring it up again in the month of January. See if we can push close to that limit of 10 participants as possible. Okay, one other thing, HCG testing, of course, the most sensitive test determining if any cancer is present at all in as small a cluster of cells as 12. That is specific. And anyway, HCG testing, we won't get into the trophoblastic theory right now, but it turns out that HCG should and is elevated in 80% plus of all cancers, no matter where they are. Just needed a sensitive test to be able to detect it. We are the draw station for American Metabolic Laboratories, run by Dr. Emil Shandel, who's been on our show. If you need some background information to become to appreciate HCG testing for that purpose, I refer you to the archives. Just go to my website at djcmd.com and click on the icon on the opening page marked archives. Go to October 10th and October 12th, 2 different shows, both of them dealing with this trophoblastic theory, both of them dealing with HCG testing in entirety to bring you up to speed to allow you to make the decision as to whether or not you think this would be a worthwhile test for you. I tell you that it will be, but if you need more information, I turn you to those particular shows. October 10th and 12th. Just go to the archives at djcmd.com. Okay. Preliminaries out of the way. Let's take a break. We have 2 out of 3, folks. 2 out of the 3 shows in the trilogy of LDA. What is that, you say? Well, that stands for low-dose antigen, the most unique way of treating allergies that I've seen in a long while. We're going to hear it through the eyes, lips, and brain of one you've come to trust, Dr. Roy Kerry. So stay tuned. We'll be back in a moment with Dr. Roy.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Well, sorry, I gotta go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Monday morning version of the show, and it's part 3 in the trilogy discussing a unique treatment for allergy through a gentleman who, I don't know, his entire career has been based on treating allergies from various and sundry ways, many of which have never been approached by the conventional medical community at all. This particular approach also could be put in that category, but he turns to it now as one of the greatest ways of treating allergy he's come across, and we impart that to you so you can listen a bit, think on it as to whether or not you might like to become involved in this kind of treatment, and turn you loose to Dr. Roy and myself, actually, as the year proceeds. You'll see when that should happen. But it is entitled LDA, standing for Low Dose Antigen. We have Dr. Roy back with us right now. Let's say good morning and welcome back, Dr. Roy Kerry.
Good morning, Dennis. How's everything down there?
Well, down here, everything's going well. Of course, unbelievable weather we're having for December, but I'll take it and just shut up with it. We've been really intrigued by our discussions with you, Dr. Roy. Whenever you speak, I always listen. In fact, the entire Western Pennsylvania listens. And your level of expertise when it comes to allergy, to put the full force of your reputation behind a new way of treating it, well, was tempting to learn more about it. Now that we're learning so much more about it, we're going to cap it off today and discuss the more exotic ways that allergies can affect you that you wouldn't even think allergies could be responsible for, and we'll get to that in just a moment. But let's sort of bring, and I never know who the new listener is. We always have them who may not have heard any of the previous two shows. And it'll do good to sort of review for those who have been participating anyway what this thing called LDA actually is. Do you want to take it for a moment and just try to put it in your own words?
We always abbreviate things in medicine with 3 letters or 4 maybe. It's complicated to saying all these big long words, but low dose antigen is just that. The dosage of the antigen is extremely low. Most of the time when we do the standard allergy injections, testing, and treatment, we're dealing with dilutions of 1/5, maybe done out to 3 to 6 exponents over top of 5, which gets you over maybe 1/10,000 dilutions of the actual serum prepared from pollen or dust or mold or foods. This is starting at number 8 of not 1/5, but 1/10, which goes way out there to 1/10 to the 17th power. Now, if you put a fraction together, that's 1/10 quadrillion. This makes it extremely safe because there's such a low dose of exposure to the antigen. Even things like peanut and shrimp can be in there and help treat these things that nobody else even should test, let alone treat. They don't offer treatment for these anaphylactic foods that are life-threatening. Even testing can be a life-threatening event. So this makes this one totally safe. Now, the second feature is that the injection is not twice a week like we do for some foods, or once a week for things that you breathe like pollens or cat fur. This is every 2 months. Now, what does that? The difference is it's treating not the immunoglobulins, but it's treating the T suppressor cell and teaching it to go off and tell the T helper cell, which makes us get allergic to things that we shouldn't be allergic to. It calms it down and balances the response to a non-reactive state of the immune cells. The T cells have a half-life of 60 days at least, and out to probably a year or more, that they stay alive and do their job. And so the interval injection starts for about a year every 2 months, and then it goes out to 3 months in the second year, and then 4 months or once or twice a year out into the third year and beyond. We might even use 4-letter words like curing well, but people tend to deteriorate a little bit, they get a booster, and then they're fine again for 6 months or a year. So that's the major facts. Another one that might interest people is it costs less, which is about maybe 40 or 6% less than a traditional injection therapy.
Okay, that's the first time that one came up. What's the cost, more or less, Dr. Roy, for our listeners?
About $200 per shot. Some physicians charge a little extra if they take an extra shot for a specific item, but this only takes 2 or 3 minutes to administer, and so we keep it at $200 for whatever you need. Some people require a shot for the, let's say, another disease that's odd is thyroiditis, or arthritis might require an additional injection, or chemicals require an additional injection. The mixture has one choice of being low dose or medium dose, so to speak, because again, it's still very low dose, but there are 2 selections there. If a person has terrible eczema or terrible asthma, we do start a few injections, a little lower concentration out there, more dilute and then go to the medium one, and that's about the only choices to make. So the other interesting thing this allows us to do is not do any testing, which is phenomenal. We always test people for whatever we put together and make the right ratios of the injections of the different things in terms of their different degree of sensitivity. But this is so low dose that you treat everything in one shot. We even put now, in the original research, we would do separate testing and separate treatment, but now we put all the things you breathe and all the foods in one shot.
Yeah, I mean, there are over 300 plus antigens in there, which is unheard of in the conventional medical community, where they do test one antigen at a time, all the way up and down the arms, and quite a mess, I'm sure, on the inside of the arm where the testing is done. Here, no real testing needed per se, at least injection testing. You use a computerized program in your own office to simulate and get some ideas as to what the allergy environment is in any particular individual, but no skin testing needed. Over 300 plus allergies, sort of everything rolled up into one shot, but because the antigen levels are so low, you say 10 to the 17th, 1 per 1 quadrillion in terms of the amount in it's like a one drop in an ocean, for goodness sake. This is where the safety comes in. You don't need to do the testing. You can put everything rolled up into one, and as you say, because you're attacking the T cell system instead of the B cell system, and they have a life expectancy of 90, 100 days, so on and so forth. This is why the treatment can be stretched out, and such little amount of injection is really necessary over time. So far, so good, Dr. Roy. Anything else you want to mention?
Well, what makes us decide to treat often is the fact that the person's been treated before or had testing before, or any doctor said you ought to be referred to an allergist for evaluation. That's probably a good sign that you probably do have an allergic mechanism. And then as we go on this program, we're going to talk about things that most doctors wouldn't even suspect an allergy as being the cause of a mechanism. Most of the gastrointestinal bowel diseases, this month is the ulcerative colitis and Crohn's disease month. It's declared by the Senate, I believe. And I heard a program about that, and they don't have a cure for it. We have treatments, but we don't have a cure for it. But nobody even thinks it's an allergic mechanism.
Well, let's just say, why don't we move to these diseases? Because, people, when they start thinking of allergies, they're very easily able to associate the possible relationship between allergies and ear, nose, and throat issues. The very thing that you specialize in is what people have been drawn to you for your entire career. And so I don't think the public has much of a jump to make when they feel there might be an allergy based on symptoms of ears, nose, and throat, whether that's runniness, infections, continuous infections, you name it, ear infections, and the like. But then there comes into play a group of disorders that would catch you off guard, that you wouldn't necessarily think had a thing to do with allergies, and you brought up the interesting category. In fact, you made a statement in the first program. You said, as far as you were concerned, any gastrointestinal illness should be considered a possibility as being allergy-induced. Would you take this for a moment? Because I believe this is the topic that our listeners really need to hear from. GI problems are so prevalent. What has your experience led you to conclude now of many, many years of working with allergy, in particular the ones you mentioned a moment ago, and then others besides, and the effectiveness of allergy treatment on that population subset?
Let me tell a little story about gastrointestinal disease. Most infants spit up, right?
Yes, they do.
I think that's normal. Well, what the child is trying to do is get rid of whatever you put in it because they're reacting to it. And I'll tell the story about my son's baby. He was born on the West Coast about 6-7 years ago now. And she was spitting up and collecting, got a rash around the mouth and a butt rash at age 2 weeks and wasn't gaining weight, So my son called me and said, what do I do now? I said, well, she's allergic to mother's milk. And he said, that's ridiculous. You're supposed to nurse the baby for 6 months at least. I said, yeah, but what's mother eating? It's getting through the breast expression. And so do a bioset treatment. Now we're going back to the other treatment that we've been doing for 20-some years, Dr. Ellen Cutler's idea. And I taught him over the telephone how to do it. Well, he's a computer nerd out there on the West Coast. I said, lay the baby down, face down, and get some mother's milk in a little glass bottle and put it in the on the baby's skin, let's say down below the diaper band or someplace on her skin, tap from the back of her head down to her tailbone 4 times. Now, you don't do that once. You do it every day, and for a week or so while mother gives a new sample. And by the end of the week, the baby's well and eating like a champ, and the rash went away. And everything's fine. But at 6 weeks, we start putting on, or 6 months, I should say, putting on some baby food. So they gave her some carrots from the jar, and baby got rash again. Now then I said, well, she's going to be allergic to things, and it was interesting and somewhat ironic that she got allergic to the very thing that Dr. Membetterpet got reacted to, that discovered this whole system of the treatment with chiropractic and acupressure points. So
the carrots, you mean?
Yeah, that was what Dr. Membetterpet reacted the very first time that she found this concept. And so I said, now, go over to see Dr. Cutler. Now, by chance, my son lived 5 miles from Dr. Alvin Cutler, who was my mentor in this whole thing. And he went over and did 3 or 4 treatments with combined treatment with the computer and everything, and the kid's well and still not allergic to any other foods. But that was kind of a miracle way back when they were infants. And so the infants are sitting up, they have a food allergy, but they don't need antacids and all these new medications. They're actually putting children on these antacids now and shut off the whole digestive system, which is kind of insane to stop your stomach acid, because you have to have that to get your foods digested properly. The problem with foods is that you're absorbing proteins undigested, and they should not be absorbed. You should absorb amino acids that are well digested. So let's get back now to the LDA, and we can treat children 6 months or older with this, and one of the more common things that we have trouble treating is even autism. So what's that have to do with allergies? Well, all these children have food allergies, among other things, and toxicities, and they all have significant food allergies, and autism is being treated by the doctors who treat many children have found it a major improvement to do this with the LDA. Simple thing, one little injection for the whole mixture of all the foods and all the things they breathe, and every 2 months, and it's not terribly inconvenient, and it's less expensive than a whole bunch of other things that we do for autism. But and it helps a lot. Now, I didn't say the word cure, but it helps a lot.
Yeah, this giant category, GI, big category, neurological, big category. I'm going to start going down through a list, and I think by mentioning the disorder itself really helps our listener come to the understanding where allergy has played a role in the past. It's well known medically that it has, yet as a layperson, they may not have ever seen that relationship made. Okay, let's take a look at some of these neurologicals. We'll return back a little later to the GI. Mental confusion. How about all the Ds? You know, when it comes to children and with respect to the D disorders like ADD, ADHD, PDD, it seems like you slap a D on the end of anything, a kid can suffer from it. But there's a large group of kids out there in that category of hyperactivity disorders that appear to have an allergy component. And in your experience, have you found that to be true? And have you found patients to be responsive to allergy treatment, no matter if it was a Cutler format at the time and the Membetterpet, or now your most recent LDA approach?
Well, yes, the problem with the other methods, they're time-consuming and get expensive, and have to treat a food at a time generally. With this thing, the 300 that I crack, well, then it solves a whole lot of problem. You get immediate results. So we often teach people to do elimination diet, but how do you know what to eliminate? Well, the computer workup helps, but you have to eliminate everything to get results sometimes. So how do you guess on everything? So the treatment of this technique covers the waterfront of all the foods that you might be allergic to, and therefore you get response rather quickly because you've covered the waterfront of possible allergens. Otherwise, we have to do some sort of a diagnostic test to ferret out which foods are the problem. And so I'm not sure of these allergic mechanisms, but they're off with the neurotransmitters. Dr. Doris Rapp in Buffalo has a series of illustrations of when testing children with skin testing, how the behavior goes berserk. They bite their parents and fight, and then once you get them neutralized with that technique, they're calm and cool and collected and intelligent and sit and draw pretty pictures instead of screaming their heads off with the food reaction affecting the brain. Now, I don't need to take the time and probably don't know how to explain the whole mechanism of the brain effects of food reactions, but it's pretty obvious when you see these videotapes of these kids treatment and fighting the parents and then calm them down with the right corrective dose on a specific food. Interesting phenomenon.
Well, you, in your experience, have you treated a number of patients with this sort of cascade and category of pervasive disorders and ADD and HD? And percentage-wise, how effective have you been in cases? Because the more rare cases are always brought to you, Roy. So what do you think? How effective has allergy treatment been in this group?
Well, Dr. Trader's website's the best way to go for that, and some of these things are into the at least 60% range of success. And the total score of the 68 diseases we're looking at, most of them are above 60%. The very few at the end are a little less, into the 40% range. Something like Meniere's disease has a 53% disease. But again, that's a neurologic type condition of the inner ear, same mechanism. But most of these things are over a 50% range. The interesting thing, the things we talked about first with all the upper respiratory, they're pushing almost all of them above 80% success, which is phenomenal with an allergic treatment method.
Yeah, I do remember you mentioning about 86%, which I was astounded by. Our listeners are happy to hear about that and to know that there's such an effective way to treat their chronic allergy problem in the well-known category of what they consider to be allergy without much of a problem. But that'll bring in these more exotic things, especially with children, where in the case of, if we're talking about allergies of rhinitis and the like, there is a conventional treatment for it. Maybe not as good, but there's one out there. When it comes to autism, ADD, and ADHD, there is no real great treatment at all, and putting someone on Ritalin could happen to be the worst way to treat these kids, but that's the way the conventional therapy would work, certainly not reversing anything at all.
Something like headaches, they're not really an aspirin deficiency, and migraines are not an Imitrex deficiency, and these two have a very high percentage of success with treating allergies, but ADHD is not a Ritalin deficiency either. But this is the conventional thing. The pharmaceutical companies taken over our economics in America because everybody thinks that a drug is necessary to treat a disease. Well, if you look at the cause, and you fix the cause, you don't need a drug. And so what we're doing with this is finding the allergic causes, and we fix those, and success.
All right, let me run a couple other by you in the neurological category. One that catches me a little surprised, epilepsy, any type of epilepsy, multiple sclerosis, Tourette's. I would have never considered any of these three to be allergy related. Tell me about your experience in those three areas, if you have any.
One clue to asking your doctor if the disease is an allergic mechanism is to look at the treatment that's traditional. And many of these things we treat with steroids. That suppresses the immune response. And so if you get any success with steroid treatment for these therapies of the different diseases, it's probably an allergic mechanism.
Oh, what a pearl that is. Great pearl. If steroids have been used and been beneficial in the past, you got to consider allergy because it's immune system related. Good point, Roy.
Right.
Very good.
So back to your question, what was it again?
Well, I was asking if you had treated any patients with epilepsy or MS or anything like these more severe diseases, and I could see now where steroids have been used in all of them that I just mentioned. Have you ever had any success with any individuals with any of these problems?
Let me give you one more pearl.
Okay.
And that is that celiac disease or gluten sensitivity is one thing that we don't fix. This is a genetic fixed disease that has to be treated by the diet restriction of gluten. I had one patient whose seizures cleared completely. No one could ever treat them, and she was in her mid-30s. No medications worked. And as she went on a gluten-free diet, then her seizures cleared. And after being on the diet for several weeks or months, now, the interesting thing why she went on the diet was her sister was a Down syndrome, and they were in their mid-30s, lived together, so she just simply did the diet with her and found that the seizures cleared. Now, she went to a birthday party for her mother a few months later and took one little piece of pie and had seizures again for about 2 weeks, and she said, I got so dumb mentally that I flunked some exams in graduate school. She was in graduate school and was making A's and B's and flunked some exams for 2 weeks until the gluten cleared from her diet. So this does not fix gluten sensitivity. But I'm illustrating this to mention that these two things, epilepsy and being smart, can be affected by the food reaction. And that was a gluten sensitivity, which we can't fix, sadly, with this thing. It's just a genetic thing. The other thing we can't fix is a nightshade sensitivity. Some people have difficulty with potatoes and tomatoes and that sort of foods. It's a toxic response. You can't excrete the toxins in those nightshade plants, and they develop arthritis, and stopping that can completely clear the arthritis as a food toxic response. Now, the other things we can fix, though, is all the food allergies can affect epilepsy and all these mental conditions also. And so simply stopping the food reaction can resolve the underlying brain difficulties.
Okay.
Insomnia is another one in there somewhere. Yeah, number 44 on your list there. You would think that insomnia is caused by allergic mechanisms, but there's, again, a pretty good response rate from insomnia.
All right. Let's do this, Roy. Why don't we take a short break? When we come back, I'm going to spell out those GI disorders once again, point by point. There's about 5 or 6 classic ones. Then we'll move to another category, arthritis. Remember, anytime steroids may have worked, the pearl was immunological mechanisms are behind it. More on that and LDA with the headmaster himself, Dr. Roy Kerry. Be back in a moment with the part 2 of the show.
Healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dr. Courtney?
Yes.
We have him. So when you come back, you can just, I won't beep you or anything.
Okay, how's he sound on your end?
He sounds okay here. We'll see what it's like on the air.
Okay.
But it was just, it was just starting to be too low.
Okay.
All right. I'll put you back on hold. We're coming back.
All right. Hey, good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney here. We're here discussing with Dr. Roy Kerry a unique treatment for allergy called LDA. We've been doing so for the last 2 shows. We now bring it in on show number 3, part 3 of a trilogy, hopefully to round out the entire discussion today. Of course, Dr. Roy's been treating allergy since 1969 as a well-accomplished ENT, that's ear, nose, and throat doctor, where allergy, you just know allergies are involved with those kind of patients. But the LDA treatment that he now settles with is miraculously able to help people he's never been able to help before in a way that is quite uncumbersome at all. Dr. Roy, you with us, my friend?
Yes, I'm here.
Okay, glad to have you back. I know we got to establish a different phone line communication hopefully our listeners will be able to hear you a little better. Speak right into that telephone, doctor. And could we take a moment here to allow patients who may be listening to you, listeners, that might think they'd like to be treated by you, just tell them how they get a hold of you to do just that.
Well, I don't think the length of the phone line was the trouble at here, because my one office is in Portersville, which is 35 minutes from the point in Pittsburgh with Route 79. I'm at exit 96. You can look it up on your map. It's just a 35-minute drive with no stoplights. And my office, the first office on the left as you turn on exit 96 toward the little village of Portersville. The phone number is 724-538-2600. That's our Greenville office, which we answer most of the time. We're like Dr. Courtney, we're in Monday, Wednesday, and Friday, different offices, and Tuesday the phone may not answer.
So they're calling Greenville to schedule at either Greenville or Portersville, and the majority of people listening to us right now who are in close to the city of Pittsburgh need to know that exit 96, 2 exits before the Grove City outlets. I think they got a picture of it now, Roy.
Yeah.
So that's a way to do it. Once again, your phone number, please.
724-588-2600.
Okay. Now, we're returning to a discussion of this LDA, low-dose antigen, and you brushed over a discussion of a very important category. I'm coming back to it now. That GI category you had mentioned, because it was in the news, there had been some congressional recognition of people who suffer from ulcerative colitis and Crohn's disease, 2 very common disorders that whenever you lump something in a category of a syndrome like IBS, irritable bowel syndrome, you're dealing with something that conventional medicine really doesn't know what to do with. Is that a fair assessment, Roy?
Yeah, but look at the name of the diagnosis. It's just describing it. And the best question is, so what's irritating it? There's got to be something irritating the bowel. What's in it? Well, food is the main thing. Now it can be parasites, fungi, and things like that. Bacteria can be affecting the colon. But food allergy is ignored because nobody knows how to fix it. As you mentioned in your lecture last Thursday, that the reason all these heart tests that you can do, nobody does them because they can't fix anything but cholesterol. And with the Crohn's disease and so on, any disease also, I tell people, they're named from a famous doctor that practiced 100 years ago. We need to relook at and say, well, quit calling it Crohn's disease and say, what causes it? You know, it's food allergies, let's fix it. As simple as that. So all the other therapies, if you look at things, they're using steroids and they're putting cortisone enemas and all these things to treat the local inflammatory response. And everybody agrees that inflammation is a big problem. But I don't think of it being allergic inflammation. So the whole gut series, it's a mistake not to try food allergy treatment for anything that involves your colon.
If I were to ask you, and maybe you can refer to Dr. Schrader's list, in terms of effectiveness of LDA on this group of disorders, are we in the 66% category, or are we moving higher toward the 80s, or somewhere in between?
Now here's one called gut fermentation, it's 66%, irritable bowel 69%. So we're way above 50% in results with this whole set of diseases.
Very interesting for those who are listening out there suffering from any one of these terminal small intestine and colon-related disorders. They're heretofore. I mean, people just go through periods where there's quiescence, and then they get a sudden rush of symptoms that lasts and quite debilitating for a short period of time. Usually that's when the doctor calls for the steroid. I think a question to ask yourself, listener, is how many different times have you been put on a steroid for your flare-up? And if this thing keeps on coming up that, yes, I flare up, he puts me on steroids, it quiets down, I flare up again. That cycle, Roy, is the telltale cycle. The peril is if you're using steroids and they help, it's immune-related, and it more than likely is allergy. Fair enough, said Roy?
Good. Irritable bowel here is 69%, and chronic anal irritation is 70%. So we're pushing 3/4 of the people that can be helped by looking at the food allergy mechanism.
Okay. Let's move to another.
GI tract, I think the reflux and all these things also, particularly infants, are trying to get rid of the food, the reflux, get it out of there the fastest way possible. So the infant digestive diseases need to look at allergy mechanisms always.
Yeah, the child expresses everything through the GI tract. Any problem with a child is going to be expressed in vomit. They vomit. No matter what the problem is, you're going to get emesis as the telltale sign that there's something going on in a kid. And adults, they take on various forms, but kids, you can pretty much just count on it. Okay, another group, I think, of high in number out there of our listeners has got to be in the degenerative joint diseases, particularly the arthritides, rheumatic, and osteo combined. These are well known to respond to steroids at various times. So once again, the little pearl works. What is the percentage of assistance in, if you can look at Dr. Schrader's results here, with the arthritides, both rheumatoid and osteo?
Well, I have a hard time finding my way through this. It's very fine print. They can go on Dr. Schrader's website. I don't really mention that. It's www.drshrar.com. You can look at these themselves. But arthritic, let me admit first that osteoarthritis is a wear and tear situation also. So you beat your joints up, you're going to develop deterioration of your cartilage. But the other ones are inflammatory, and the drugs available in any case go on our immune mechanisms that you're working with, as well as everybody knows the steroid, the osteoarthritis. So here's the...
Are you there, Roy? You got to speak up. Roy, you there?
Yes, I'm here.
Okay, we just for a moment there we lost you. So I don't know, maybe you turned away from the telephone or whatever, but okay, you're back. I hear you now. Everything's loud and clear. Anything, Al, you want to pull it with respect to the osteo and rheumatoid arthritis? Anything else you want to say?
The remedy there, additional injections for people, but that's no big deal in terms of cost. There's some bacteria involved with these things that we have to treat with antibiotics also. That's an old-fashioned theory that's worked for rheumatoid for years by a group of doctors that will use antibiotics, but food allergies are a big component also. You have to treat the whole waterfront of the allergic mechanism there.
All right. Here's one that interested me, and maybe will interest the listener, and that is PMS, premenstrual syndrome. Sort of catches us out of the blue, catches me off guard just a bit, but and I don't think that I see steroids used in this particular case. Do you, or can you make any sense of hiding her hair of this category of disorders? Plenty of women suffer from it, that's for sure.
I use a lot of hormone therapy for that, and people actually get allergic to their hormones. That gets a little more tricky when you do some neutralization, especially for progesterone. I'm not sure how much this particular mechanism works for that. I have trouble finding the exact disease on the list. He doesn't have either of them. It's alphabetical. But I get some success with MS and fertility, even with allergic mechanisms involved there. Another area to think about is skin. You haven't touched that at all yet.
Yeah, why don't you go ahead and, because you mentioned urticaria and other skin lesions frequently yourself, just sort of out of the clear blue sky, and it must be something you always use, at least to consider allergy responses with respect to the dermatitis, dermatitis that you can get, the eczema and so forth. So, okay, in your experience and our listeners who may have these problems, what can you say about the relationship between them and allergic response?
Well, pruritus is, everybody knows that you itch with allergies, you get hives and so on. That has a 65% success rate with LDA. Psoriasis, 58%. That's a tough one, too. Again, dermatologists treat with various creams and so on, and steroids are a major treatment. That psoriasis has a 58% rate with LDA. That is underlying allergic mechanism. The skin is an allergic instrument that illustrates it. And, of course, we test people with the skin. Well, that's logical that psoriasis. I also think that surface fungal infections are involved there, and this treatment includes a lot of the fungi, mold, or that in the foods. We eat molds all the time with our cheeses and mushrooms and so on, and those trigger the reactions of the molds that were covered with molds on the skin.
All right. I guess it's just safe to say the list appears to be endless. If you're out there and you have a condition that just doesn't ever seem to get fixed, it just keeps on coming back and haunting you, even whether or not steroids may be the pearl, which I thought it was a real pearl that you laid on us, Roy, allergy more than likely should be considered, and knowing that there's an LDA format where so many antigens are included, and you mentioned some unique thing last time you were with us, Roy. There may not be a specific antigen in there for your particular problem, but because of the cross-reactivity and the fact that you have so many antigens in there, they sort of morph and become the right antigen for you. Did I hear you right when you mentioned that? And could you sort of pick up on that and describe that phenomenon once again?
Yeah, Dr. Dor Brown was an expert in this area half a century ago, and found that many pollens cross-react to various fruits and vegetables. Now, where they come from? Well, we get our things off of trees and plants, and so the pollens can somewhat cross-react with the foods. And many foods are like each other. Like you look at that whole nightshade group of plants, they can actually cross-react. So we're taught by Dr. Schrader that don't even show the list of patients because they might find a food from Tahiti that's not in there and they can react to it. No, they'll probably cross-react to the ones that are in there. So it covers the waterfront,
Okay.
all fruits and vegetables, etc.
All right, so bringing this to a conclusion, if somebody's interested in receiving LDA treatment and they do call your office, what's the procedure, what's the process they're going to go through on the first visit, and then when can they expect to see you again, and how quickly can they expect to see their symptoms become abated? That's something you would be able to speak from a great deal of experience. How's it work?
Well, first, if they need to call the office, one that takes the history of the phone to save time in the office, and that type so I can read it quickly, even sometimes before you come. When you come in, we'll do look at the history and include if you do have an allergic hint, so to speak. Then I like people sometimes do a computer workup that is almost fun, basically for kids. And then I'll give you a list of foods. You might want to go home and try to stop eating those foods for a week or two. I almost do that as punishment for the patient because it's hard to do and not fun. But it proves the point when you get your symptoms quiet down with a fairly strict diet and eating several foods. Obviously, it's going to help to fix them. So then the injections are given every 2 months. Now, we haven't told anybody the hard part, and that is when you're reactive to foods with an enzyme that potentiates this reaction, you have to avoid those foods for 3 days, the day before, the day of the shot, the day after. In fact, I'm getting my injection today, so my wife, she has migraine headaches, and latest thing. Called parties or whatever, but we do it for 3 days. You're on a root crop diet. Things that grow underground don't seem to have much allergenicity. So that's what we're eating. And for meat, we use a meat we don't usually use, like lamb. We have this pink book called Dr. Schrader put together. It has all these rules and regulations. You have to read that twice to qualify for doing the shot because many things completely interfere with the response. Most drugs, pain medications, but for people that is something difficult. That research projects, we find that only 2% of people that were considering this turn it down. The cost part is watching this strict diet for 3 days and avoiding exposures to your problem thing. One thing we haven't mentioned is chemical sensitivity. It's a major part of my practice, and people that are allergic to fumes like perfume, hairsprays, they become social hermits because they can't be around these in the public, and somebody else is wearing it will a severe reaction, asthma, headaches, migraines, and these kind of things that occur from chemical sensitivity. This has a separate reduction for the chemical sensitivity, but it's very successful for that particular problem that almost nobody else has any good remedy for it other than being a social hermit. The success rate of chemical sensitivity is about 65%.
Okay, we literally have about a minute to go. Let's just say this, that I'm looking forward to my training on January 18th, where I don't know if I had mentioned to you, I looked at my calendar. I'll be up there to spend a day with you trying to teach me, as you've done so often in the past, the LDA approach. In the meantime, you don't have to wait for me, folks. Get on the phone. Once again, your phone number up there, Roy?
724-588-2600. I could probably even squeeze a few people in today if they want to come up.
How about that? Take him up on his invite. We'll be talking more about LDA in the near future, but we thank Dr. Roy Kerry so much for doing what he's known for best, bringing you into the realm of what is absolutely brand new and works better than anything that preceded it, LDA, low-dose antigen therapy for allergy. Hope you've enjoyed the 3 shows we spent with Dr. Roy. Dr. Roy, thank you so much for coming aboard with. I'll be talking to you in the very near future. Have a wonderful holiday, Dr. Roy.
Thank you. Same to you.
Okay, there we have it. We're going to say goodbye now for myself and Dr. Roy Kerry. Don't forget on Wednesday, Dr. Vava Vavoom herself, Susan Smith-Jones, will be our guest. Bye now.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
KHB wants you to know this year more than 4 million homeowners will face foreclosure. If you're one of them, make sure you're talking to the